Hi everyone, and welcome to Mountain Health Today. I'm Ted Owens, your host, and this show is brought to you by the Tahoe Forest Health System, covering a variety of healthcare-related topics for your interest. Today our guest is Mr. Harry Weis, Chief Executive Officer of the Tahoe Forest Health System. We'll be back in just a moment. Welcome back to Mountain Health Today. Harry, good to have you with us. You've been CEO now for more than a year with the Tahoe Forest Health System, and I know one of the things that is very important to you that you often speak about is the legacy of Tahoe Forest, how it came to be, why it's in the Truckee-Tahoe region. If you would share with us a little bit of that story.
Thank you, Ted. These special historic stories are really critical to healthcare, and the special story of Dick Joseph, who he and his wife arrived in Truckee in the 1920s and really decided to make a home in Truckee and own several businesses, and were prominent individuals in the community. And several years later, Dick and Margaret were expecting twins, and very regretfully, Margaret passed away during childbirth of the twins. And what's really special about this story is that...
I don't mean to interrupt, but Harry, I wanted to back up. They were traveling, if I recall, down to the nearest healthcare services or hospital, which was Reno.
Correct.
And this predates I-80, so that was quite a journey in and of itself, and that complicated?
That is correct. There wasn't really a hospital to deliver babies at that particular time, and so Margaret passed away due to difficulties in delivering the twins, and just a very sad, avoidable healthcare tragedy. And so what Dick did, he could have focused inward and not really done anything positive in the community, but he did something very special, and that is to really reach out to save lives for thousands of residents that might live in the community and for many years, many decades into the future. And so around the 1950s, he donated land, which really became the catalyst for where Tahoe Forest Health System is today. And not only just the giving of the land, which started the hospital, but then giving annually just about every year since then via the Joseph Family Trust. And that loving act has saved thousands of lives over the years.
So I know that in California following World War II, there was enabling legislation that the citizens took advantage of to create a hospital district.
Correct.
So Tahoe Forest is a special district or a governed hospital.
Correct.
It's fair to say that if Mr. Joseph had not donated the land, that it wouldn't be there today because the citizens didn't have enough oomph to really push it. So it was a combination of the ability
Correct.
to form it and then his generous donation.
That is correct. And he really recognized that when you really rank all those most important things in life, whether it's bank accounts, homes, retirement accounts, etc., that precious gift of access to proactive, holistic health care is the most precious gift. And he wanted all residents for all future years to have that here in Truckee. And so he made that very important gift of land and then money in subsequent years.
And I also understand that he did lose a son in the war.
Yes.
And so the street that leads you into Tahoe Forest is named after his son as well. So he had
Yes.
two daughters.
Yes.
And they continued the legacy. How did they do that?
Well, they continued it really, I believe, heavily with Dick's sisters over the years as well, really making sure that that they stayed attentive to Tahoe Forest needs and really making annual donations every year for many decades, even to the present.
Even to the present day.
Yes.
And I understand that more recently at an event we had representatives from that family trust that still gives today.
We sure did.
And those are significant gifts, and they're very important to healthcare in the modern world. Share with us why that is.
Well, in healthcare, every community has great challenges with starting of healthcare, and so to have this loving act, this benevolent act, who knows whether healthcare would have really taken off, how big it would have been, when it would have happened, and to have had roughly a 65-year legacy, give or take a year or two, that's a very special outcome from a loving act, roughly in the 1950s. So very special.
And that was a very different time. I know that the first hospital, the first building, I think we had 11 beds in there at that time,
Right.
in the early 1950s, and that served all of eastern Nevada County and eastern Placer County, and some other areas as well.
Right.
So that was a rather broad area, although not as heavily populated as it is today. I wanted to ask, we're going to get into a little bit of discussion later on how the hospital has grown. But I know it was with your urging that the new Women's Health and Newborn Care honors the Josephs. And you felt that was very important.
Right. The whole catalyst was the regretful loss of Dick's wife, Margaret, in a childbirth situation. And to really, as we focus on a brand new Joseph Family Women and Newborn Center, which is the name, it had not had a family name or legacy name attached to it, that our team really wanted to honor that legacy, that founding legacy for Tahoe Forest Health System, and call it the Joseph Family Women and Newborn Center, which we're very humbled to share with the whole community. So it's a reminder of a very loving act as we look to really find other individuals in our community who have the same loving attributes as the Joseph family did, so that we continue to propel healthcare forward in a very loving, proactive way.
I believe, I probably am speaking for many, that there's a great deal of appreciation that you locked into that legacy and that history of our Truckee Tahoe region. And I would tell you that I think you've given some rebirth to the memory of the Joseph family and the generosity through philanthropy that they've provided. So I thank you for doing that, for being one that's new in the community. That's quite a feat in and of itself.
Thank you.
This is Mountain Health Today. I'm your host, Ted Owens. We're going to take a break, and we'll be back in a moment and continue our talk with Harry Weis, CEO of Tahoe Forest Health System. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and our guest is Harry Weis, Chief Executive Officer of Tahoe Forest Health System. Harry, earlier you shared with us the history of philanthropy, the great gift of the Joseph family, provision of the land on which the hospital itself stands today. If we leapfrog forward to today, we see a much different hospital. It had to grow. Earlier, you and I were looking at those photographs outside of Squaw Valley, the Olympics in 1960. And that brought a lot of attention to the Tahoe region, and people moved here. Share with us how the hospital grew during that period.
Right, the hospital grew from probably roughly 11 beds to more than 25 beds at one point, just due to this steady population growth that has happened within the district that includes the Tahoe Forest Health System. So we had steady growth every year, plus these huge surges of individuals who love to come to more than a half a dozen ski resorts and great summer activities as well.
Which means that you have to be large and small at the same time. You have 39,000 people, I think, that reside in the district full time.
Correct.
But Christmas and New Year's, that could be 139,000.
Absolutely.
The hospital found itself in a situation of non-compliance with respect to seismic codes in California. And so something had to be done. And what resulted was a second wave of support and philanthropy from the community in the form of Measure C, to not only meet those seismic requirements, but also to produce the kinds of services the public wished to see. Share with us Measure C and how that came to pass and what it's done.
Measure C was very positive, very important for Tahoe Forest Health System, and it really showed almost an unparalleled level of support from voting residents in our district. We're 72% approximately of the voters back in September of 2007 said we'd really like for you to, we want Tahoe Forest to be here for the long term, so you need to get the seismic upgrades done. We want to see a strong emergency services program. We want to see orthopedics. We want to see an obstetrical program. We want to see your extended care facility. We want to see a special continuation and growth of cancer care. And then very importantly, in addition to that request, they said, we're approving $98.5 million of tax-exempt general obligation bond funding to help you do that.
Harry, you mentioned cancer care, and the Cancer Center is a very, very big and important component of Tahoe Forest today, the Gene Upshaw Memorial Tahoe Forest Cancer Center. Also affiliated with UC Davis. It was UC Davis's first rural prime affiliation with a hospital. How has that proven to be a game changer in delivery of rural health care?
The Gene Upshaw Memorial Cancer Center is an amazing cancer center with chemotherapy, radiation therapy, all the spectrum of cancer center programs. But in addition, it has, during every weekday, it has a tumor board covering each specialty of cancer. We're also able to do clinical trials with UC Davis as well.
Let me back up a little bit, because I want to touch on the tumor board. The tumor board, describe that. What is that for our folks at home?
What it does is it allows cancer experts locally in Truckee at UC Davis and at other prominent points to really do a case study on individual patients as to what is the most evidence-based treatment plan for that particular cancer. So it's a great consultation, if you will, for a great outcome right here for our patients that are seeking care here in Truckee. And the other thing that's really neat about the Gene Upshaw Memorial Cancer Center is that probably over 35% of our patients come from zip codes outside of our district. They really recognize the quality of care and value this regional cancer resource.
I also understand that the delivery of care is such that patients may come for diagnosis but be able to return home to many of the northern counties, for example, and receive their medicine at home through their primary care physician.
That is correct. We use some really neat telemedicine communication to the patient and physicians in their community so that they don't always have to come to Truckee for every episode of care.
I also understand that we have a lot of second homeowners that opt to have their cancer care performed in Tahoe Forest rather than where their primary residence is.
Absolutely.
Harry, what does it mean to the region, the impact of Tahoe Forest in economic terms?
That's a great question, Ted. As we are so appreciative of the taxpayer support being a district hospital where we get roughly $5 million a year in property taxes and about $5 million for the general obligation bonds for that Measure C topic, what we look at is what is the return on investment back to our taxpayers. And what we've seen, I think, in 2007 and 2012 in that era from the University of Nevada, Reno, that the economic value coming back to the community is at least $9 for every $1 that the taxpayers are providing us. And I think the most recent study of just a few years ago, it was over $150 million economic benefit back to the community. So that's kind of our loving gift back to the community for them investing in us and our privilege of serving all residents in the community.
Now, healthcare is, as we all know, a very expensive proposition.
Correct.
We're going to come back in a few moments and talk a little bit about that. But it's even more costly in the environment that Tahoe Forest is located in. Snow country, seismic country.
Absolutely.
There isn't anything inexpensive about being located there. So we'll come back, we'll talk a little bit about that. This is Mountain Health Today. I'm Ted Owens, your host, and our guest today is Harry Weis, Chief Executive Officer of Tahoe Forest Health System. We'll be right back. I'm Ted Owens, and I host a new program called Mountain Health Today, where we'll talk about all things healthcare and how it affects you and your community. Welcome back to Mountain Health Today. Our guest today is Harry Weis, CEO with Tahoe Forest Health System. Harry, before we left, we were talking about the cost of living index. Tahoe Forest is in a very expensive place for many reasons. Construction costs are higher.
Right.
Certainly, California regulation is higher. How do you view Tahoe Forest's costing structure compared to other places that you've been?
As I look across California and have worked across California, I was really shocked, to say it plainly, how modestly priced the inpatient care and outpatient care at Tahoe Forest is. And again, we're in a cost of living index that's around 1.57. State of California is about 1.36. Reno, for example, is about 1.10. And at Tahoe Forest, I found that our inpatient charge structure was about 40% below the statewide average of California, and we're more than about 60% below the statewide average in outpatient care, which is very unusual in a high cost of living area.
Earlier, we were talking about how the hospital district was formed. It's a public agency.
Correct.
Approximately 8% of revenues, both with Measure C and property taxes,
Correct.
Come in. The rest is enterprise. We have to operate like a business.
Correct.
And in a challenging environment. But what are the root causes that drive the costs of healthcare?
That's a great question, Ted. Those really critical drivers that are really unique in healthcare, and healthcare is probably the only business in America that has this feature where we have to provide a service regardless of the ability to pay, and only probably the court system would have similar responsibilities. No other business out there does. And so the normal laws of supply and demand that people learn in economics actually work in an opposite way because of that duty of having to provide a service regardless of the ability to pay. So that's cause number one of the key drivers that really drive up healthcare, is the requirement to provide service regardless of ability to pay. Number two is that we still have over 32 million people that are uninsured in America. Fortunately, that number has come down across America a few million, but then we also have a very problematic portion too, which is 100 million approximately that are underinsured. And this would typically include the Medicare, the Medicaid, and many insurance insured individuals where the cost of care isn't being fully paid by their third-party payers. Those are the three driving causes that are pressing healthcare charges and costs upward.
Underinsured, for example, adds to bad debt.
Absolutely.
And but still there are some that just simply don't have the ability to pay, and that falls into the charity care category.
Correct.
And those can erode the financial stability of a healthcare institution.
Absolutely.
Over time. Tell me, if another business had to operate under the same conditions as healthcare does today in America, what would it look like, say, for the sale of a loaf of bread?
If tomorrow a grocery store had our business rules, the business rules of a hospital, a $2 loaf of bread would have to be roughly $8, 4 times what it is today, so that the grocery store who bills retrospectively after the fact over a 90-day period or a 6-month period would have a math chance of collecting on average $2 per loaf. It would have to have a charge of $8.
That'd be because some people couldn't afford the loaf of bread they purchased.
Correct.
Or were served, or could only partially pay.
Absolutely.
And with respect to the Affordable Care Act, there have been a lot of changes in Washington, and I know that we're going to learn a lot more in the future. But what do you forecast? What do you see out there as the impact on healthcare across America with what's going on in the discussion of healthcare today?
Well, as you shared, we are going to learn a lot more and be talking a lot more about the Affordable Care Act and its possible replacement. The thing that really concerns me going forward is that healthcare is going through a phenomenal change era, very rapid changes, and there's just a plethora of sources and literature and writings out there that are suggesting that as much as 1/3 of U.S. hospitals may not survive by 2020. And our focus at Tahoe Forest.
Excuse me for interrupting, but how many hospitals would that equate to?
It'd be roughly more than 1,600 hospitals in America out of 5,000. And our focus here at Tahoe Forest is sustainable, high-quality health care. So we do not want to be a part of a 1/3 of those hospitals that might not make it in the future. When you focus on rural hospitals in America, I think the latest literature is talking about that as much as 50% of the rural hospitals could be at risk just because of economic and regulatory changes that are going on. So again, we're focused on being a part of the sustainable rural health systems in America.
So we're also, excuse me, a little unique. We keep saying rural, but we're kind of rural plus.
Correct.
We do have major interstate that passes very close by that we serve. We have a lot of tourism and visitors and
Right.
second homeowners that we
Right.
serve as well. Other rural communities, it's fair to say, don't have that advantage that we
Right.
do. So that's a benefit to Tahoe Forest. As things move forward, we'll be picking up more information. I'd like to know if you'd be willing to come back and meet with us again here on another program when more is uncovered with the changes to the Affordable Care Act that might be coming down the road. Take me up on it?
Love to chat more about those rapid changes that are coming.
Okay, we'll do that. Thank you for joining us today with Mountain Health Today, brought to you by the Tahoe Forest Health System. Thank you to our guest, Mr. Harry Weis, the Chief Executive Officer of Tahoe Forest Health System. Thank you for being here.
Thank you.
I'm Ted Owens, your host, and we'll see you soon. I'm Ted Owens, and I host a new program called Mountain Health Today, where we'll talk about all things healthcare and how it affects you and your community. Thank you for joining us today on Mountain Health Today, a program about healthcare to our greater region. I'd like to thank Harry Weis for being with us today. He's the CEO of the Tahoe Forest Health System. If you'd like to view this program at your own convenience, you can do so at tfhd.com. I'm Ted Owens, your host. Next month, we'll be bringing you another program where we'll be discussing hospital services in the greater Truckee-Tahoe area. Thank you for joining us.